Good morning, everyone. I want to thank you for joining this morning. A couple of things before I introduce our presenter. We are recording this event, so everyone will stay muted. If you have any questions, please submit them to Don via the chat button on the upper right-hand corner, and he will answer them at the very end of the webinar. Also, I'd like to ask you to join us for the second webinar Don will present, which is April 14th at 10 a.m. The topic will be what you're missing, how to drug test more effectively. Don Teeter is a board-certified family physician who has lived and worked in Western North Carolina for the past 27 years. Because of the high rates of opioid abuse, addiction, and overdose in his area, his practice has changed to focus more on addiction treatment. He still sees patients 2 days per week treating addiction and providing primary care to those with mental illness. Since March of 2013, he has worked as a medical advisor at the National Safety Council addressing the national epidemic of opioid abuse, addiction, and overdose. Without further ado, I'll go ahead and pass it over to Don. Good morning, Don.
Good morning, Katie. Thank you for the introduction, and thank you for the opportunity to present. And I welcome all of you to this webinar. We will be talking about opioids, and I certainly I'm glad that you're listening. This slide does have my email address on the bottom as well as my cell phone number. If there are any questions afterwards that we do not answer, feel free to contact me, and I will be glad to give you any advice that I can. So I am a family practice physician. I still practice medicine 2 days per week in the western part of North Carolina, in the mountains of North Carolina. I do addictions treatment at 2 different programs. One's a mental health center and the other is a methadone clinic, treating people that have become addicted to these medications. And this really became my passion because I realized that many people who were becoming addicted because us doctors were prescribing too many of these medications. And so I hope to speak out and change how we treat pain a little bit and make it so we're not using so many. But in the meantime, we've really seen these medications infiltrate our society and our workplaces. And I really think it's an important issue as we address workplace safety. So first of all, let's start off by just clarifying what are opioids. So opioids are pain medications that are derived from opium.
Hey, Don.
Opium, yes?
Sorry, are you sharing your screen?
Oh, hang on. I thought I was. You're not seeing it, huh?
No.
Okay. So I've got a thing that says share file, but that's not share screen. Share my screen. How's this? Can you see now?
Yay!
Okay. All right. Well, we didn't miss anything yet.
All right. Thanks, Don.
Yeah, thank you for letting me know that. Okay, so there's my email address. I think you all will have access to that later. Feel free to contact me with any questions. So as we talk about opioids, they're derived from opium. Opium is the content that grows in the seed pod of the poppy plant. And poppies are pretty flowers. Oftentimes they grow around the sides of roadways here in the United States. They plant them because they're attractive. The ones we plant in the United States do not contain opium. That's a special type of poppy that's grown largely in Afghanistan and now in Mexico, actually. Much of the opium comes up from Mexico. The opium itself consists mostly of morphine and codeine, and a lot of the other products we have are derived from those 2 chemicals. So the common opioids that we're talking about today are morphine, oxycodone, hydrocodone, methadone, codeine, fentanyl. There's a few others. There's methadone, but these are some of the common ones. Some of the brand names that you might know is Percocet, Vicodin, Oxycontin, Opana, Dilaudid, fentanyl. So these are pain medications that are used very commonly for treatment of pain these days. 20 years ago, that was not the case. We seldom used these because we felt that they were very dangerous. In the past 20 years, we began to believe that they were much safer. We wrongly believed that, so we're now understanding that, again, these are very dangerous. We have about 20,000 people that die from overdose of these medications every year, and many more that we don't even know the number of people that die because of accidents or injuries that occur as a result of using these either at the workplace or while driving. So how do opioids work? You know, the non-opioid pain medications we use are ibuprofen, acetaminophen, which is Tylenol, naproxen. Many of these are over the counter and they work very well for pain, but opioids work in a completely different way. And this is one of the most important things to understand as we talk about these medications, is that they are really brain medications. So while ibuprofen and acetaminophen and naproxen and some of these other non-opioid medications work by decreasing inflammation at the site of the injury and actually reducing the pain itself, these the opioids don't work very well decreasing pain, but they make it so that your brain doesn't care so much about the pain. And many of you have heard people say this, or even experienced it yourself, where you've taken an opioid medication like Percocet after an injury or after a kidney stone, and you think, well, they're not helping the pain much, but I sure don't care much about it anymore. So really they are working in the brain to reduce the mental distress that is associated with the pain. So as we look at the efficacy of pain medications at actually reducing pain, we see that ibuprofen actually works better than oxycodone or morphine at decreasing pain. So the opioids actually work in the brain, and that's really important to understand. Because of that, because of their work in the brain and the changes that occur in our brain, they actually cause impairment, and this is what's important to understand in the workplace. So how do they impair? Well, first of all, they cause drowsiness. And I think everybody has experienced that before. If you've received some in the hospital, I get kidney stones, and in the past I've gone to the hospital and they'll give me an injection of morphine, and right away I feel like it's hard to stay awake. Now, the pill forms of these medications, like the Percocet and the Vicodins that people get prescribed to take on an outpatient basis, they also cause some drowsiness, and people will be a little less sharp, will be more likely to go to sleep if they slow down or if they're working at a desk job. But oftentimes they don't realize that, again, because of the way these work in the brain. Oftentimes they make people think that they're sharper, they feel more alert, but it's just not really the case. They also cause lethargy, which is fatigue or tiredness, and they slow reactions and reaction times. Oftentimes this is imperceptible to supervisors that are seeing people work, or to family members watching people on these, but they do slow reaction times and they cause some lethargy. So if an incident is about to occur, there is a delay as far as them responding to it. So, for instance, with a driver driving a vehicle, if a child runs out in front of their vehicle, ordinarily they may have time to stop, but on these it may delay the reaction by 0.2 of a second, which may be enough to cause a significant injury. So slow reaction time causes lethargy. Again, oftentimes this is not perceived by the person who is taking the medication. They decrease concentration. So in some places in the workplace, this might not be so important. We see this a lot in white-collar workers, actually. They're just not nearly as productive doing their work. They can't concentrate as well. Their brain tends to go from one subject to another and actually causes an issue with attention. And finally, another thing they do is they cause poor decision-making and impulsivity. So again, an example with driving might be if someone's driving and they go to make a left-hand turn, and they're judging the risk of the turn with the oncoming traffic, and it might be that there's a small gap that ordinarily they wouldn't try to make it through, but in this situation they think they can make it and they just go for it without thinking through the entire decision. So again, something that can certainly be a problem at the workplace. So it's also important to understand that some people take these for acute injuries, and some people are on pain medications chronically. They take them on a regular basis. And for acute use, if somebody has an injury, if it occurs at the workplace or at home, whatever the case, and their doctor gives them Percocet, say for a sprained ankle, all acute use is impairing. People that start on these and have taken them for less than 3 weeks period of time, they are significantly impaired while taking these medications. So if you have somebody at work that has an injury and their doctor gives them these, they will be impaired while taking them. Now, there's a little bit of controversy regarding people that are on chronic stable doses of opioid pain medications, and there are a fair number of people we don't know for sure, but we estimate around 6 million people in the United States take these on a daily basis for chronic pain, like back pain or headaches. And there are some studies that have shown that maybe people on a chronic stable dose are not impaired because their body gets used to it. We don't really know that for sure. There was a review article recently that looked at all the studies that have been done on this, and their impression was that for some people they can take these on a chronic basis and not be impaired, but for most others that is not the case. And there's a lot of other factors that will make somebody impaired where they hadn't been before, such as if they don't sleep well the night before. The lack of sleep and the fatigue from that will make them impaired if they're on these medications chronically. If they're on any other medications, it can often interfere with these and cause impairment. So it's hard to know if people who are on these chronically are impaired or not. So it's probably best policy-wise to just say that you cannot use these opioids if you're working in a safety-sensitive position at our workplace. We'll talk a little bit about some policy suggestions, and this is clearly one of these, that there should be a no-use policy for opioids for those working in safety-sensitive positions. Now, there's also an issue with people that are not in safety-sensitive positions, just the risk of them driving back and forth to work. So at the end, I'll give you a link to a work. We've got a whole bunch of a toolkit. We've got a toolkit that you can download and look at some certain policy things you should do and how to respond to people that are using opioids. And I encourage you to use that, and I'll give you that link in a minute. But as we talk about workplace policy, again, I believe strongly we should say that there should be no opioid use at work. And I will say this isn't really about the efficacy of opioids, this talk isn't, but I will say there are lots of studies that show that ibuprofen works better than the opioids at relieving pain. People recover better, they recover faster, they have less missed work, so encourage your employees to stay off of the opioids totally if possible, but your workplace policy should be there should be none at work. You need to have in your policy that if they ever do get a prescription, they need to report it to their supervisor so that alternative work accommodations can be made. This way, if they get a drug test done and it turns up positive and they say, oh, well, my doctor gave it to me, but if they had not notified their supervisor, it's still a breach in the policy. You need to work with your medical review officer. Let him know that he must report positive drug tests even if somebody has a valid prescription. In many cases, MROs are taught that they're just looking for illegal drug use, and it's important to know that for safety's sake, they need to be looking for any drug use, and you need to educate them regarding this. So if there is a positive drug test and the person has a prescription, it still needs to be reported to the company. So again, alternative work accommodations can be made. So another one is that positive drug tests for anyone who hasn't been has not reported a prescription should be referred to your EAP for evaluation for possible substance abuse issues. So it's estimated about 1% of our adult population are addicted to the opioid pain medications, and I will share with you that people in workplaces know all the tricks to try to get around the testing. So oftentimes that first positive test is an indicator there's a problem, and that should be referred to see if there is a problem and for treatment of that problem. Another thing that's misunderstood is that opioid addiction is not easily treatable, but it is very treatable. So if they can get into an appropriate treatment program, there is help for these people. So here is the link to our prescription drug employer toolkit, and this has policy suggestions. It has brochures on how to educate your employees and your supervisors. It has brochures for your doctors, if you have doctors that work for you, on how to use alternative medications other than opioids for treatment of pain. And it's free to you. Feel free to get on there and download this toolkit. We encourage its use. So that is it. It looks like it's about 15 after. We'll look at questions. Let me see if I can bring up the questions. Okay. Chat is what I want. Okay, are there any questions? All right, are there any state laws that do restrict the MROs from telling the employer? So I don't believe there are, not if you have this in your policy that opioid use is not allowed whether it's prescribed or not. I will say that there are a lot of drug testing laws that are different from state to state. So drug testing is one where you need to talk with an attorney who knows something about drug testing and what's legal and what is not. But I think as far as the MROs go, I think, again, it can be your policy that these are not allowed at work, and the MRO needs to report them if you know, even with a legitimate prescription. And again, it's very important to make this in your policy that you're doing this for safety reasons, not to determine illicit drug use, that it is a safety policy of yours. So I will say that Katie mentioned that on April 14th we'll be doing a webinar on drug testing. We have done a survey, and about half of the employers we surveyed are not testing for the right opioid pain medications. So if you're not testing for a full panel of opioids, I hope you will attend that and understand why that's important to identify these folks. Do we have any other questions? What do I see as the biggest problem? You know, first of all, it's just a significant problem that doctors are prescribing too many, and that happens a lot in the workplace. So if you have employed physicians, they need to be educated and not use these opioids. People that get an opioid prescription for an acute injury, it doubles their risk of disability 1 year later. So a lot of folks get on these opioids and just can't get off. But the other problem is, I think I'll put in a plug for the drug testing seminar, in that many people are just not testing for the right drugs. Many employers just have a 5-panel test kit, which will miss the great majority of those people that are abusing opioid medications. So I hope you'll join us for that.
All right, Dawn, very, very good information, and I know this is a large problem right now, so we greatly appreciate you coming on and educating us. Again, I want to go ahead and ask everybody to join us for the second webinar that Dawn will present, which is about how to drug test more effectively, which will be April 14th at 10 a.m. I just want to thank everybody for joining this morning, and if you have any questions, you can email Dawn, or you can email us, and you can also go on our website at txthrivingconcern.org and get lots of resources that way as well. Dawn, would you mind going ahead and putting back up the slide with your contact information? That way,
yes, I will.
That, they can write it down again. Just real quick here. And then NSC, on NSC's website is where the drug testing kit is available. Is that correct?
Yes.
Okay. All right. Thanks so much for your time today. I appreciate everybody coming on this morning and listening. Have a great day.
Thank you.